Okay, do you have a frozen shoulder? Big question. You might be developing some shoulder pain. You're not really sure what's going on. Sometimes you'll have pain radiating down this area when you have a frozen shoulder. Occasionally, even develop a little bit of neck pain, especially if you've had this shoulder pain for a while. So, do you have frozen shoulder? At the end of our video, we're going to go through three quick stretches that you can do at home. Very easy. You don't need any special equipment, anything like that. So stay tuned. And also, we have a lot of great videos on other topics, sciatica, ankle point, knee pain, all sorts of other things. So subscribe to our YouTube channel and you'll get some of those notifications. So anyway, so a frozen shoulder, it's really not well understood in the medical community, all right? It's actually something that we understand certain people are at a higher risk for a frozen shoulder, but we don't really completely understand exactly why it occurs. And it's a bunch of thoughts on it. But it can be a very painful condition. A lot of people have a lot of night pain, but they really lose their ability to do a lot of things they like to do, whether it be especially any kind of overhead sport, anything you need motions above your shoulder height, especially reaching to the side, even getting up to your back, your upper back and things like that, swimming, overhead motions like that you may do at the gym. Those things you can lose, and it's gradual, so sometimes it sneaks up on you. So anyway, that being said, what we do know are there certain people that are at a higher risk of getting a frozen shoulder. Okay, and those people include people between the 40 and 60 years of age. That's where I'm in the sweet spot at 49. People that have diabetes, people that have thyroid problems, women, it's more common. Sometimes post-surgical cases are another category of people that are at a higher risk. So if you're in that category and you're developing the shoulder pain, you want to kind of watch it so it doesn't get too tight, because the shoulder essentially is tightening. So let me explain how it gets tight and a little bit of the anatomy of the shoulder. So the shoulder girdle right here, this is Bucky, our skeleton here. This is our shoulder joint right here. It's resting essentially on the trunk here in the rib cage. There's a few joints that make up the shoulder girdle. The one that we're concerned about is called the glenohumeral joint. And the joint is this one right here. We're showing Bucky right here, and essentially the joint comes together in a very shallow socket, okay? But around there that provides support is a joint capsule that's made up of ligamentous structures, and it's kind of like a bag, okay? And you want to think of a bag, a normal bag, and a normal shoulder can take, hold a cup of water. Let's say it can say 8 ounces of water. What happens, unfortunately, gradually, it kind of sneaks up on you, is that it slowly shrinks to a half a cup of water. All of a sudden, there's less room in that bag. Now, that bag's supposed to provide stability, but it gets too tight. It actually restricts your motion. You physically can't move it, and if someone else can't even move it when it shrinks and tightens, okay? So you've got a lot of inflammation in the early stages, and then eventually it tightens for a while, and then eventually thaws. So let me explain those phases. I kind of went over it kind of quickly. So this first is the freezing phase. That's essentially 3 to 6 months. And gradually say, I can't move. I feel a little tight at the end, but it'll probably go away. I probably slept on it wrong. Okay. After that period of time, you have like 6 to 12, maybe even upwards of 18 months in some cases. It actually is frozen, where that capsule is not moving. You're not losing more range of motion, but you're sure not gaining any range of motion. And it's painful at night. Simple tasks like reaching across, to the passenger side when you're driving, to the side or at the desk. Especially those movements are very painful. And you start avoiding it, and you almost get tired because your body starts realizing how painful it is, and you lock down. So you have that frozen period, and then you have the thawing period. That could be 18 months to 2 years, long time. So this can be a very debilitating condition, and 1 or 2 years out of your life is a long time. I've even heard upwards of 3 years with some folks. So take this seriously and really kind of recognize it. If you're not sure, you can go to a therapist to talk about it. Most can kind of say this is probably what it is, or go to your orthopedist or something, and they can identify this. But it's important to understand the early stages, because there's things you can do that can kind of get you out of those early phases, and you don't lose as much range of motion, and you'll feel better. You'll function a little bit better. Not everyone. Some people don't respond to that stretching and that kind of approach, but definitely it's something that you want to consider, to look at and not just let go. Other things about it. So you have this reason. Occasionally, patients in the clinic too, is when they can't move their shoulder, they'll do, I call it a shoulder shrug sign almost. It can be similar to a rotator cuff. They can't quite get their arm up. They start developing a lot of pain because some of the muscles around here, since it's so tight, can't move. So they try and move the whole shoulder girdle, tries to move. Unfortunately, it uses muscles that attach to the neck down to here. So sometimes, unfortunately, you get a combination of some neck problems and a shoulder problem at the same time, especially if it's been going on for a while. So, so those are some things just to consider. Some of the approaches, oftentimes physical therapy has been shown in research to make it go a little quicker, a little range of motion. The important thing is that the patient does a lot on their own. So it's important that you do a lot of stretching besides when you're at the physical therapy office. The other thing is occasionally you need an injection, so that's something you want to talk to your doctor about. It's not getting better. I've had patients say, it's just, Tom, it's getting better, but I feel like I'm in a little bit of a plateau. And they'll actually do a cortisone injection or some injection to help it along. The next phase in more extreme cases, and actually has some pretty good results when you look at the literature, is actually under surgery, they knock you out. And when you're knocked out, they move the shoulder and they stretch this joint. And they loosen up the capsule, and then they have you do some stretching afterwards to reinforce it. And it's not too bad as far as the results on that. But that's the last step, and hopefully you never have to go to that step. But let's go ahead and take a look. I'm going to move Bucky out of the way, and we're going to have Kyle, my assistant here, and I'm going to show on him what you would notice as far as range of motion loss, and then we're going to show you the 3 exercises that I'd like to have you try. Okay? So we're going to move Bucky out of the way. Okay. Okay, so Kyle, come on over here. We're going to have you sit down here. We're going to face this direction. So we're going to have Kyle do a couple movements, and you'll see, what I'm talking about. So let's put our elbows at our side, and we're going to bring our hands wide like that. Now, in a case of frozen shoulder, if you do this at home, it'll give you a little sense. If you're in the mirror, let's say this side is not the side that we think the frozen shoulder is on. You'll see that the motion is right about here. They cannot get past here in cases where it's more in that frozen period, that frozen phase. And when I go over to the person and I try and move it, I can't move it. I can't move it. If you have a rotator cuff tear, you may see the same thing. You know what happens? I move my arm like this, all of a sudden he can move out. So frozen shoulder, he can't move it and I can't move it. So if it's tight here, do it at home, a little self-test like that. It's like, wow, this one's in. This one goes out all the way. That's good range of motion. This one, can you move it, Kyle? No? Well, sorry, you can't move it. You can't move it. It stays right there. And when I try and move it, I can't get it past there. Okay, another motion. So we're going to try and bring our arms to the side like this. So bring it all the way up. Now Kyle has really good range of motion. Now bring your arms down. So in the case of frozen shoulder, you'll often see, bring that arm up all the way to the side. This arm, bring it up, and he'll stop like right about here. He'll actually hike. You'll see the whole girdle move up like that. And when I come over to check it, I'll check it here. I can't get that motion, all right? I physically can't move it. Not just him, I can't move it. You can have, unfortunately, a rotator cuff tear and a frozen shoulder, but we're not going to worry about that. But you'll see, wow, I can't quite move that, can't get that motion. So bring your arm down. Now bring both arms down. Now we're going to go forward. This direction is typically a little more range of motion than the side direction. So bring both arms up. He's got good motion there. That's great. Good. Now in case of frozen shoulder, this one will go right about here. Starting point might be here. Guess what? I can't even get it past there. It's not the muscle, it's the capsule. It's tight. Can't quite move it past that point. Okay, bring your arms down. We're actually going to show another direction. Kyle, let's have it turned around. We're going to face that way. And you're going to stand up, actually, buddy. Let's come over here. And I'm going to guide you right about there. So we're going to bring our arm back. Let's do this one first. Let's see how high you can go back. Okay. So another common problem, let's say this is the good side now. This is the injured side. A lot of times patients will come to me and they'll say, wow, I can't quite get to my belt. Okay, and if you're a woman, you can't quite get to your bra. So frozen shoulders for women are actually a lot more of an issue if they're trying to get to that bra strap right here. Guys just have to get to their belt. And they'll say, wow, I can get up to here. This one, he's actually a little tight himself on the other side. But this side, they'll get almost right to their to the crest right here, right to the bone here, and they say, I can't move any further, and it hurts. So those are common what we see. And I can't even move it past it. Like it physically doesn't go past that point. So those are some of the directions you'll see and some of the differences you'll see with a frozen shoulder. So let me show you, we're going to show you a stretch with a cane stretch. The first one we're going to do, Kyle, is we're going to stand, we're going to face there. Put your hands back here, like this. And we're going to try and use the uninjured side to try and move the injured side. So we're going to turn a little bit like this. We're going to bring our arms back as far as we can, stand nice and tall, little stretch, pressure on, pressure off. You're going to do it 60 times. All the way up. Pressure on, pressure off. And this shoulder extension, 60 times, once or twice a day. Okay. The next one we're going to do is we're going to do 2 other ones that I like to do lying on his back. Okay. So we're going to get rid of our bones here. You're going to lie down with your head up here, Kyle. If you have any questions, post it in the comments. I'll actually respond, I promise, okay? All right, the next one we're going to do is we're going to take our hands. We're going to hold it like so. And we're going to try and use the good side to stretch the opposite side. You can also do this with pulleys, which we'll show maybe in another video. Bring your arms all the way over till you feel a little stretch. 1, 2, and then back to the starting position. So that's overhead elevation there. So all the way back, let's do one more. Little pressure, and then release it. In the first 6 months, when it first starts happening, you don't want to aggressively stretch it, because sometimes you'll start losing range of motion if you try and stretch it too much. Our type A personality is really trying more is better, sometimes not. It's more good pressure and frequent movement every day, okay? But a little bit, it's more of a marathon here. Okay, the other direction, which is kind of hard to do, I'll be the first to say it's kind of hard to demonstrate. I'll typically take a little towel. We're going to say this is the frozen shoulder side, just for demonstration purposes. Kyle, we're going to move you that way just a little bit. You're still on your back. We're going to scoot that way a little bit. I'm going to put this underneath his elbow. And we're going to put his palm out like that. He's going to take his other arm. He's going to hold it. And he's going to bring it out like that, almost like he's pitching. If you look from the top view, out like that, and then back like that. So all the way out. We're using the good side to stretch the injured side. So the injured side is on the roll. It's really important to have the roll right underneath the elbow right here. And if you look at Kyle right here, his arm's a little bit off to the side. Okay, so a little bit out like that. Pressure on, pressure off, pressure on, pressure off. I would say 60 for each direction. Try and do it 2, maybe 3 times a day, depending on your tolerance. Okay, but it's a good way to warm it up. Those are our 3 stretches. That's probably the most common stretches that I give. Every person is different, so sometimes I'll give slightly different stretches depending on the person, and also different guidance as far as how we're going to stretch you. You should not feel worse in the sense of you shouldn't have 2 or 3 days where you actually have less range of motion. Then you want to adjust it. You don't want to push it quite as hard. But you do want to put some pressure on because we're trying to loosen that capsule that's gotten tight and it's shrunk. Okay, this is very mechanical. Okay, but there are other things that could be going on. When in doubt, there are people that can have other problems that can give you pain in the shoulder region. And if you're unsure and you try this for a couple weeks and it's not getting better, I suggest talking to a doctor about it. Talk to a therapist. But post some comments or questions. People will get some thought out there. And I hope this helps you out. So subscribe to our channel. You can also follow us on Instagram and also on Facebook. You can always come to the clinic and talk to me a little about any kind of problem. We have a 30-minute consultation called a discovery visit. Come on by. And best of luck. I hope this helped you out a little bit. And have a great day.